Mr. Speaker, the AHS website says naloxone kits are available free of charge to anyone at risk of opioid overdose. If you get a kit at a community walk-in clinic or pharmacy, you do not need ID or a prescription. I've spoken to someone who last week had trouble getting a kit at one pharmacy that wanted ID and approval, but had no problems at another pharmacy that didn't require these things. To the Minister of Health, what steps have been taken to ensure that all pharmacy staff across the province are trained to consistently issue naloxone kits without ID or prescription?
The Honourable Associate Minister of Health.
Thank you, Mr. Speaker, and to the member for the very important question. I'm really proud of the work that our government has done to make naloxone kits free and available across the province through harm reduction agencies, through medical practices, and through pharmacies. We are working with the College of Pharmacists in particular to make sure that the message is clear with their membership, that any time that any Albertan walks into a clinic or to a pharmacy, and requests a kit, that they are given one free of charge. It is up to that individual whether or not they wish to leave their name with the pharmacist, but those kits are available, and I'd be happy to follow up with the member about the specifics.
Supplemental.
Given the purpose of supplying naloxone is to save lives, and given naloxone is proven to buy crucial minutes in the case of an opioid overdose, to the Minister, what metrics are being collected to ensure the naloxone program is saving as many people as possible from overdose, and how is the program ensuring people aren't being excluded?
Minister.
Thank you, Mr. Speaker, and to the member for the question. I think the best way that we can make sure that people aren't excluded from access to naloxone kits is to make those free of charge and as widely available as possible. To date, we've given out more than 49,000 naloxone kits across the province. We're working with partners in the nightclub and entertainment industry on how they can support their staff and other workers in diverse industries who might be at risk of seeing someone who is at risk of an overdose, so that there's that widespread accessibility of those kits across our province so that if they're needed in an emergency, they are available.
Thank you. Second supplemental.
Given that thousands of people use public transit and services such as taxis and ride-sharing every day, and given that these modes of transportation can often be the way to get help in the case of an overdose, if the question is, if the naloxone kit program is to have the intended effect of saving as many people as possible from dying of opioid overdose, will you work with local transit authorities and taxi commissions across Alberta to ensure naloxone is available on trains, buses, and in taxis?
The Honourable Minister.
Thank you to the member for the important question. That's a great suggestion. We are doing working on a number of fronts to that respect, and I'll make sure that to raise it with the Commission. But I would ask that the honourable member maybe raise the issue with the leader of her party, who, when he was health minister, declined $1.4 million in no-strings-attached grant funding from the federal government at a time when one Albertan a day was dying of the overdose crisis.